My name is Stephanie Carl. I'm an obstetrician and gynecologist at CHRISTUS Trinity Clinic. I grew up in Ennis, Texas, just south of Dallas. I was actually born in Lubbock and moved to Ennis when I was 2 years old. My parents had a farm there. My father was an insurance underwriter also, and my mother was a teacher. So there was lots of hard work 24/7 between jobs and a farm. But it was a small town and it was a great place to grow up where everybody knew everybody. I had a really nice childhood, great family life. Personally and professionally, I think my mother had the biggest influence. I had no idea I wanted to go into medicine. I went to Texas Tech for college and I was working on a business degree, and she was diagnosed with breast cancer in my sophomore year of college. After going through everything with her and seeing the treatment that she went through, she actually enrolled in a clinical trial. She had a very advanced breast cancer, and when she was first diagnosed, we were planning her last Christmas. I mean, we really did not think she was going to live. She enrolled in a clinical trial at Baylor in Dallas and went through an experimental level of the chemo that is actually what is curing so many ladies now, and she survived 27 years after that. But at that point, I became really passionate about learning more about what medicine could do for people and became very interested in women's health. I actually got a job as a receptionist in a doctor's office and quickly changed my major to pre-med, and actually went to work in a cancer research lab at that point, and really thought about going to research for a little bit, but then learned that I like the clinical side a lot better. I think this is the coolest specialty in the world. We are the only specialty where you can see your patients from, the most amazing moment in their life when they're giving birth and still be seeing them many years later when they're going through menopause and needing hysterectomies. We know their whole families. By the time you've done 9 months of obstetrical care on a lady, they're like family. And then you could still get the surgical side, and I love the procedures and the general wellness care of women. I do believe that it's very, very important to look at patient care just like you would want to be treated. Going through everything with my mother, I also lost my husband to cancer 3 years ago, so I've been on the family side of difficult situations, and I know that there's nothing worse than waiting for information and not getting it quickly, and just thinking about how you would feel in that circumstance is the most important thing for a doctor to do. So, quick information and treating people just the way that you would want to be treated, I think, is the most important thing.